Welcome to the Healthiest Tech Talks, where we're talking about some of the biggest challenges facing healthcare organizations today and how technology can transform the way we work so that patients receive better care. I'm your host, Natalie Tollefson, Senior Director of Customer Success at Optimum Healthcare IT. Let's dive in. All right. Thank you, Scott. Hi, everybody. Welcome to our 6th episode of Healthy as Tech. Today, I have two very special guests with me, and I cannot wait to introduce them. First, we have Chris Esper, who is our Workday subject matter expert here at Optimum. Chris is a seasoned Workday leader, having held multiple roles with top-tier IT services and consulting firms. Chris started in the delivery area, leading major HCM and ERP implementations in the healthcare and higher education verticals. And he holds 7 Workday certifications across that platform. So we're really thankful to have you here today with us, Chris. And I hear that you have a kind of a secret talent, huh? Why don't you tell us what that is?
Sure. So one of my secret talents, I shouldn't say it's a secret, but I was able to spend 8 years implementing Oracle at Gallaudet University, and was able to become fluent in sign language, which was really a fun skill to have.
That is pretty cool. I was just practicing sign language alphabet with my 9-year-old yesterday on the walk home from school. So awesome. And then Peter Ford is here with us. He is the Senior Director of Facilities and Business Applications at Stanford Health Care in Palo Alto, California, just down the way from me. He has over 20 years of experience working in healthcare technology as a vendor and also on the provider side. And Peter currently oversees non-clinical applications at Stanford, including the ServiceNow platform. And Peter, you shared a hobby with me that I found a little bit of jealousy over, but why don't you share that with the rest of our audience here?
Sure. I'm a collector of hobbies, but I think the one that I've probably stuck with the longest is I'm an avid cook, both at home with family and friends, but I also have had the opportunity over the years to cater and do various events, dinner parties, and other things. So it's always something I love to do. It gets me away from a computer screen.
Okay, so you'll be sharing your contact info for catering requests after this webinar. Everybody stay tuned. I'm just kidding. Thank you, Peter. Thank you, Chris. And for those of you who may not know me, I am Natalie Tollefson. I actually have over 14 years of experience working as an HR practitioner within healthcare and also as a technology leader, both on the healthcare provider side and the consulting side. And I have a fun fact, one that I like to share in icebreakers. I once had the opportunity to throw the first pitch at an Oakland A's Major League Baseball game, which was pretty awesome. So
that is a good experience.
If you want to know more about that, you'll have to reach out to me on LinkedIn and ask me for more information. All right. Well, I know everyone is not wanting to hear about, my fun facts and wanting to hear more about Stanford and what we're here to talk about today, which is ServiceNow and Workday. And guys, I can't tell you enough how much I hear this topic, and I'm in conversations almost daily with customers, really trying to figure out, if I have Workday or I'm about to implement Workday and, we have ServiceNow, but maybe we're only using it for IT, or, I'm talking with ServiceNow and I like what I'm seeing, but I just spent all this money on Workday. How do I justify both? The list goes on, and this is a very relevant topic. So the answer to the question is yes, you need both. And we're going to walk through what those benefits are, what those use cases are, and how organizations that are leading from a innovation and technology standpoint within healthcare like Stanford are having incredible success with both systems. So we're excited to jump in. To kick us off, I'm going to ask Chris to just step in and explain to us as a level set, what is the difference? When do you use Workday versus when would you use ServiceNow? And how do we look at both of those applications as complementary rather than competing against each other?
Sure. Thanks, Natalie. So I think the main thing to kind of think about in the beginning is, what is this concept of system of record versus system of engagement? A lot of times, I don't know if we ever really delve into that as much as we should during the deployment process, and really kind of digging into, when you're implementing something like Workday, Workday is for the most part going to be your system of record. It's going to be your backbone ERP system. It's going to hold things like employee data, financial transactions, supply chain information. All that's going to ultimately live in that Workday system. The other side of that is, what is your system of engagement? Like, where are employees, where are people, where vendors, whoever it is, where are they going to actually go in and make touches with the system? Where can we aggregate all the information that's relevant, all the links, all the quick shortcuts, all those things in one place? And that's really where your system of engagement is. Now, in a lot of times, you can use something like Workday as a partial system of engagement. But I think what we're talking about today is showing the power of, like, a ServiceNow being able to work as more of an overarching, larger platform for that system of engagement. So thinking about that, if your organization doesn't have a centralized service platform like a ServiceNow, your teams are always working in kind of a disjointed, difficult, like email-driven system. I mean, Natalie and I were just on the phone the other day with somebody where the business process was, we get a ticket and then we write a physical email, we send it, we hope for the best. I mean, that was a business process. There really wasn't that platform that was able to bring that together and help ease that difficulty. On the other hand, if you have a platform like ServiceNow and you haven't integrated it with Workday, you're kind of left on the other side of that, where you've got this great platform that's got all this functionality and all this power, but you haven't actually effectively linked it with your Workday system or your system of record in order to make sure that all those things you're doing in ServiceNow are reflected in your Workday platform. So really what we want to talk about today is, how do we effectively demonstrate the use case that Peter's going to be so wonderful to display for us, how Stanford Health kind of mastered this idea of, like, kind of managing a great system of engagement and tying it directly into their system of record, which is Workday. That being said, Workday is what we're talking about here today, but I mean, you could effectively, do this against a lot of your other ERPs like Oracle.
Or even other point solutions within an environment, right? Whether it be your AP system or your travel and expense system. So yeah, I mean, I think just to add on to that, Chris, there's almost two types of integrations that we're talking about here when we look at these systems. In my mind, one is data integration, and that's important for a unified user experience. But the other is really about process integration. And what does it mean to start a process in one system, and maybe that holistic process actually ends in another, but that can actually be a streamlined, holistic experience from start to finish. So I don't want to give too many spoiler alerts. Let's go ahead and jump in, or spoilers. Let's jump in. Chris and Peter, if you could talk about some of the challenges, but before Stanford Health Care moved in this direction. And Peter, you've been with Stanford for a long time at this point. What were some of the main challenges? And Chris, as you've worked with many HCM customers and ERP customers over the years, both on the Workday and Oracle side, what were those challenges that folks tend to have with that system that maybe ServiceNow can solve for?
Right. Well, I think, the first one that you always run across is this, the fragmented user experience. A user logs in, they want to change their benefits. And you're dealing with, one entry point, it potentially bounces you out to another system, potentially bounces you out to another area. It's disjointed, it's frustrating, it creates an uptick in support calls. And from an overall employee experience, people are unwilling or unhappy to kind of have to interact with the system, because what they're feeling is, this is going to be hard. Like, if you tell somebody, okay, well, you're going to have to go into the portal and update your benefits, if they know that it's a pain point, they're going to be lax in doing it. It's going to cause disruption. It's going to cause delays. It's going to cause impacts to your overall business by creating that situation. I'm sure Peter's got some Stanford Health examples to kind of highlight that.
Yeah, thanks, Chris. That is precisely the challenges that we were seeing. We've had ServiceNow for quite some time. As we moved into Workday for HCM first, we had the two platforms somewhat separate, but we knew that there was a role for both. HR still had services that they were offering through the ServiceNow platform, but business processes that were executed within Workday. Now, as we look to bring that experience together, staff don't have to remember, okay, do I go over here for one thing and I need to go to another system for another? They don't need to remember that or try to navigate between multiple systems. We're trying to bring that experience together so that users have one place where they can start and they can get help immediately within ServiceNow, or we can take them into a business process in Workday, or they can find information about how to do something in Workday. You bring that together, and I think, Natalie, you alluded to some of the other systems as well. This goes beyond just ServiceNow and Workday. The ecosystem for HR, for finance, for supply chain is made up of many different applications. So the more of that you can bring together for an employee to get started with the work they need to do, that helps them, be more efficient with their day and really focus on, as with the healthcare world, the focus needs to be on the patients, not necessarily on some of these business processes. They're important and integral in how we operate our organizations, but the focus really, we want to drive to patient care. And so this enables us to do that.
I'll interject a little bit because I'm actually thinking back to one of our earlier webinars that we did on Healthy as Tech, where we were talking about that challenge of frustrating user experience. And I was thinking back to, my experience working with physicians and building HCM, deploying HCM with physicians. And one of the mistakes that I made early in my career was building out processes from the functional perspective. Right. So as an HR practitioner, I was designing processes to make sure that I could get my transactions done in the system, and that I could make sure the physicians know what they need to do as their part of the process. And it actually backfired. The change management was not successful, and we had to make a lot of changes. And so one thing that I'd like to, just remember is when we are talking about implementing technology, improving process, starting from that user experience. Yeah. That's really where you get the most success with adoption. And then leveraging, automation and workflow and the ability to streamline the back end side of it as well. That's, I think, where you get the most synergy and the most efficiency with these processes.
Absolutely.
Natalie, I think that leads to, I like to think of that as kind of like compassionate development.
I love that.
Thinking about, how do we do this in a way that makes people happy? You're taking a thing that's not always the most exciting thing in the world to do, and how do you make it feel good? How do you empathize with those end users? And I think that leads into another of the challenges is, there's a lot of, with these multiple systems and not having everything standardized on a ServiceNow type platform, you run up against like incomplete or disjointed end-to-end processes. So you can get through steps 1 through 3 in one place, and then you wait 24 hours. There's manual stuff in the background. Then you go in and complete the process in a different system. The integrations are hung up. Things aren't going real time. That type of thing is another area where I think it creates a lot of errors, a lot of things that are hung, a lot of things that are stuck kind of in process all the time. And it creates, obviously manual work to either loosen that up, free up those processes that are stuck, or manual work to correct it because it can't come across multiple hops and all the data isn't all in the same place. So, Peter.
Yeah,
sure you hit that one.
Yeah, we've seen that one as well, Chris. In terms of, you build a business process, and as you rightly said, 75% of it may be in one core system, but the minute you take that out and an email needs to be sent to a user to get more information or to provide additional documentation that's now outside of the system, you lose the overall process, and you lose the ability to see how things are moving. Where are we? If things are getting stuck, why is it? The user is having to track that process in multiple places. So, they may be looking at the core system to say, why isn't this progressing? But there's an email that's sitting for them, waiting for some action that they need to then go do offline. And on the fulfiller side, is the business process owner is waiting to receive that work. They now also are tracking amongst multiple systems. They're swivel chairing between email, maybe it's chat messages, Teams, Slack that they're exchanging information on. Then they're compiling all that data back together to complete the work process. There's more room to be efficient there in building that end-to-end workflow so that it's easier for everyone involved to track it from beginning to end in one business process.
And I think also from a OCM or, just even a communication standpoint, having that efficiency be built out, clearly defined. I mean, when you think about, if you call your bank and you say, when's this going to be ready? Well, if the email doesn't get stuck in somebody's inbox, it should be 24 hours. But if that person's on vacation, it could be upwards of 3 weeks. Having that process nailed down, clean, efficient, I think from a communication standpoint, you can have your support team say very confidently that this process, like a change job action, will take 24 hours instead of, well, what day is it?
Yeah.
Well,
So
I'm also thinking about, the reality of organizational turnover and the fact that people leave and you need to hire new folks and they need to be trained. How much more difficult is it to train somebody and get them to 100% productivity when your processes are disjointed and spread out across multiple modalities and systems and the like?
Right.
Yeah. I mean, that really does create a challenge with staff. It leads to frustration. They're having to work in all these different systems, and more often than not, they'll figure out a way to get it done, but then that dissatisfaction grows over time.
Sure. I think, Peter, that brings up kind of my third point with this is, because they kind of find that off system or, whether it's spreadsheets, whether it's, offline databases, offline paper files, however they're going to do that, it creates a lack of actionable data for all types of things. If all these processes are, 80% in one place and 20% somewhere else, how do you actually get that full 360-degree view of like, what's that information that I need to make decisions? When you're like, well, if I look at this 80%, I'd go one direction. But if I had everything in one spot, it might be a completely different conversation. So I think the last thing is that challenge of, with this data being disjointed, with these systems not being interconnected efficiently, with the lack of integrations, you're going to run up against that data component not being available. And that's going to impact, your decision making and also, your resource planning, because you're not exactly sure what's in and what's out.
Yeah. And with that point, we were lucky at Stanford. We had, prior to our recent move to Workday, we already had engaged with our supply chain team, with our finance team, to start looking at some of those gaps and where are processes outside of the ERP that we could be tracking that are requests that are asks for help from an employee to one of the departmental users. How do we start intaking that work and tracking it through? Because it was coming in through so many other ways, phone calls, emails primarily, bringing that in and seeing how that work was being tracked and putting a number to it, a value to it, to understand just how many calls are we getting? How many emails are we receiving? Let's start creating those as tickets and requests. Then as we started bringing that together with the ERP transformation project, how could we take what we've already started to build with our partners in supply chain and finance and build upon that foundation to say, now, how do we connect that to integrate it to a modern platform like Workday? How do we bring people from the entry point of ServiceNow into Workday or another system? Where do we have knowledge about a business process that supports a workflow in another system? So you could see the whole picture there. And then from, again, starting with the end user, they have more ability to get to the information they need to execute work. And then from the back end side, you can start to measure, where are we with these business processes? Where are gaps and challenges that we can improve upon, or is there a better way to do a certain business process? You can start to gather that data and then begin to take action on those workflows.
So, Peter, has Stanford been able to claim death to the department inbox yet?
No. I think that is an aspirational goal, Natalie. I think we're proud of what we've been able to accomplish with our partners on our ERP team. I'm really lucky to get to work with some amazing people on that side and be a part of the technology team to bring all of this together. But it's a huge undertaking to automate all of that. So you have to take it a bit at a time. And, I think some of that is just, where do you get the most value? What are the things that we get 100 requests of type X per month. Let's automate those versus the one we get ones or twosy every quarter. Let's start with the big hitters and tackle some of those. And then over time, figure out, how do you continue to expand upon that? So, we know there's a long way to go. We're just getting started with this, but we definitely see the potential of how this can work together. And I think something we're excited about as we've completed this transition to Workday is to start to look at, where should we be going next with these platforms? These are two major platforms in our environment, and how do we bring them together to really work better with both of them? At Stanford, beyond just HR, finance, supply chain, we have many other services that employees can take advantage of. Our IT services, some of our nursing services, our facility services, where those are also starting to build more and more on the ServiceNow platform. So they can find lots of different workflows and processes that they can take advantage of. And, in those areas as well, it may not be everything now, but we hope to build on that.
Yeah. I mean, I think it's important to remember that this is a journey. And that's really what you're sharing with us, is the reality that it's a journey. You've never quite arrived, but it is a journey that adds, that has a lot of potential to deliver value continuously and for a long time. And that's a great transition, actually, to the next topic, which is really about, on that journey, Peter, as Stanford Health Care was, had realized the vision of how these two major platforms can work together complementary. What were some of the objections or maybe risks or concerns that you heard and faced in the business as you attempted to get buy-in for this approach across other business units?
Sure. I think, obviously these are two major platforms. So there's a component of just the cost and budget of having both of these, developing both of them, supporting both of them. But I think in our use case, we saw that while there were capabilities that were potentially across both of the platforms, there was a way we could bring them together and use different components of each. And there were specialties of one versus the other. ServiceNow is not, as Chris rightly mentioned at the top of our discussion, ServiceNow is not the system of record. It's a system of engagement. It's got a different use case. And so we saw a value of building on that for those types of employee interaction, design points and processes, and then using Workday really as the full business process. So we wanted to have both of those, and we have a large investment in Workday, and I'm sure many of the people out there who are looking at any ERP, there are they're big systems. They take a lot of care and feeding to develop, and you want to be able to use those as best you can, and really focus on the core capabilities in those platforms. So we don't want to take work out of Workday. We want to help make that work better. And so, that was something that, a strategy or a discussion that we had early on, is not to try and replicate or duplicate work in both systems, but really focus on the best part of each system.
That makes a lot of sense. And I think that's a very common misconception that people have. Not to their fault, because it can be a little bit confusing when you see what seems to be redundant functionality between both platforms. But that's where it really requires a strategic approach. And from my experience being an elite ServiceNow partner in healthcare, we work with our customers to talk through those use cases, to talk through the strengths and weaknesses of each platform, and determine, well, what's going to make the most sense for your business and what's going to serve the user the best. And so it's not always cut and dry, but it does, there are a lot of threads to pull there that I think can help people come to the right decision for their organization.
Absolutely. I mean, there's a lot of capabilities in both platforms. And, I'm just seeing some of the questions about, kind of how do you look at these two platforms? I think each organization is going to have to look at that, what capabilities they have or need to take advantage of. We found a lot of flexibility in the ServiceNow platform to do a lot of different things for us. So combining that with, and using it beyond, HR, finance, supply chain, those clearly were big, impactful business processes or departments for us to help work with. But we also had other services and other investment where, we had started many, many years ago with the IT side of it. And that's really where this all grew out of, was, building what we needed to run our IT organization, but then realizing, hey, we can do a lot more of these different workflows and automate business processes far beyond just what IT can do. And we saw that capability, be able to reach out into a lot of different areas.
And Peter, I remember, oh, sorry, Natalie.
No, go ahead, Chris, please.
Yeah. I remember when we met a couple of months ago, we had that conversation about, even if you can solve it in one, is that always the best solution? So, you could automate Workday to do certain functions, but is that really the best place to do the work? From a support perspective, from a cost perspective, I think going down and kind of looking at each platform is what are they good at? Not necessarily can it be done, is a good way to kind of view these projects. Not just say, our guiding principle is everything's going to be in Workday.
Right.
Because you paint yourself into this corner of, is it the right solution, or is it a solution that we own? So we're going to try to put everything into it. I think sometimes there's that option of some like ServiceNow being a better fit overall.
Yeah. And I think, to that point, Chris, there are things that, there may be, say, help or other services that you aren't necessarily going to do ticket management within a Workday system, or for another, if there's a separate system used in your financial processes, a budgeting system, or a outside travel and expense system. If you need help with those and you need to request service from a finance team, where do you track that kind of work? How do you bring,
Mhm.
back to our previous point, how do you bring visibility to, I need help because my expense report is stuck, or I can't submit an expense report for something that a conference I attended. Those are areas where finding the right tool to fit that task is important. And from our standpoint, we knew we could solve some of those other support services through the ServiceNow platform and support the whole department and all of the systems that they might utilize.
And Peter, if I'm not mistaken, you were able to decrease usage of things like smart sheets and other, more manual tools, because you had workflow really being generated from the ServiceNow platform for these. Is that correct?
Yeah, that's a big challenge. I'm sure there are others out there, as these kinds of low code tools are out in the market and people are developing workflows and processes with them. That kind of plays into the disjointed experience, because now I've got to remember that, hey, if I have this specific question for this part of the department, I've got to go over and I've got to find a smart sheet or some other tool, rather than being able to come to a common place where I can get access to the information, or I can submit a
Right.
request, I can take an action. So that's definitely a challenge.
It makes me think of just such a popular use case, which is provider onboarding,
Hmm.
or really any kind of new hire onboarding. And again, this topic comes up constantly. But I think it's a great example because, to your point earlier about, using Workday Help, for example, if you take the use case of provider onboarding, which really, starts with recruiting and HR, but then you have IT components, you have facilities components with setting up workspaces, you have, many other functions within the business, whether it be med staff and credentialing and others that are part of this process. And if your new hire has questions or needs support, and they go into Workday Help, for example, if that's, if they have access to that, sure, that might help for HR. But what about all these other functions that are supporting that new hire in the exact same process? And so that's an example of where ServiceNow can play the orchestration role, right? It's where you're able to store all of those tasks and centralize the user experience for everyone involved in one platform, while allowing the back office teams to do their steps within their own systems. But then at least your new hire doesn't have to see all of that back and forth, right? And they can get help from one place. So just thought I'd share that example to drive that point home.
Yeah, and in full transparency, at Stanford, that's not something that we're doing end to end today. But you're absolutely right in terms of, you bring all those business processes together and you can provide that level of transparency. We manage it a little bit differently today, but it's there are definitely challenges when some of the work is being delivered by IT, some of it's being delivered by facilities, but if they're all scattered in different systems as a new hire or a new physician, how do I know where to get that help from?
Sure. And it's a journey, so we all understand that, and plenty of lessons learned along the way.
Absolutely.
So that's great. I appreciate you sharing that, Peter, and just I think it's important for our listeners to understand what some of those conversations they may need to have, and really helping share the vision and draw the contrast between maybe some of the challenges current state, and then what the possibilities are. So let's transition. I know everybody's probably itching to see some examples, and I'd love to spend a few minutes looking at, how is Stanford using these use cases. So I'm going to go ahead and share my screen. And what we're looking at here is, Actually, Peter, I'm going to ask you to walk us through. We're gonna talk through Stanford's
Sure.
example of a portal, and then we'll talk through just a few additional use cases in the next few slides. So go ahead, Peter. What are we looking at here?
All right. So on the left of the screen is the main landing page of the Stanford Ask SHC portal. This is something that we redesigned with input from stakeholders across the organization, users of our platform. When we started our ServiceNow journey, we started with an IT portal. It had some services. It was just focused for IT. As we grew the platform, we added in other portals and other capabilities for HR, for supply chain and finance. Each one of those was separate and discrete, and people had to know where to go to find that information. With ServiceNow's Employee Center portal, we unified all of those under the umbrella of Ask SHC. Employees who knew where they went for HR to have, to access certain services, they bookmarked, this is where I go for HR. We made sure to maintain that capability. So as an employee, they could still go directly to what they needed. But they also then had the capability of looking across the entire portal. And as we added more services, that search becomes more and more effective in saying, from a single search bar, how do I see a status of a benefit? I have a water leak in my office. I need facilities to help me, or I need a new laptop. All of that could be serviced through one portal or one search capability. So we started with this redesign on the left. And some of you may be interacting in the chat with Ritesh from my team, who leads our ServiceNow team and really spearheaded the delivery of our new portal and brought together all of these different groups to standardize how we would use the technology, brought together the look and feel of this, and came up with a template that we could use in multiple different areas. So the left is the main landing page. On the right side of the screen is one of our HR pages. So within the Ask HR section, that's really focused on managers and manager actions. You can see on the right-hand side of that, the quick links. Some of that is taking users out of ServiceNow into other systems, into other business processes, directly into areas, say, within Workday as they need to. But we bring that together and we use this same look and feel on all of our subportals. So as we walk through this and we share a little bit more, you can see users have a standard way that they can navigate through the portal to find information, either by clicking and navigating through a hierarchy of menus through the mega menu at the top, or by clicking on specific links below, or they have the capability to use the search to find more specific information of what they need. And the overarching guiding principle we had with Ask SHC was really focused around three things that we wanted all of our employees to be able to do. We wanted them to be able to find information, take action, and get help. And everything that we design and everything that we're building in the platform really comes down to those three things. How do we help our end users do that? And, to Chris, your point earlier, we try to approach this from the fact that not only are we delivering this platform and this tool to our enterprise, but we also use it. I manage people and I manage teams. So if I need to find things, I want it to be easy for me to be able to get that work done and figure out how do I go reach out to HR for a function or submit a request to finance.
There's two things that stand out to me as you walk through this, Peter. One is just something that I say a lot to people when we're talking about portal design and user experience is where there's value, people will go. right? And it's like what you've done here at Stanford is really built a place where there is an incredible amount of value to users, making it easier to find things, more things can get done. And that is, in my opinion, the number one tool for change management. Make something good that people want to use.
Well, yeah. And if you build it the right way, they can find the information. It's going to take on, a life of its own. And that's really what we hope, is that this is providing that value to our end users, and then making it easier for the users to get to this information, finding new ways to integrate this into other services so that they can get to this portal, they can access these services faster, easier where they're working today. So be that within just a browser, integrating it with Microsoft Teams, which we utilize. There are things like that that really offer us some really powerful capabilities within our environment.
Right. Providing multiple ways to get work done. That's essentially what I'm hearing. Meeting the users where they are at, providing multiple ways to do, essentially the same thing. That flexibility is key. And it's wonderful to hear how you've brought that together for your own workforce.
It's a starting point, that, as I've mentioned, there's more to go with it, but at least this is the direction we want to head, and something that we can now start to build around and provide, a critical mass of services in one place.
Well, and then we're looking at the manager actions, which is fantastic, because that's another way that we're personalizing an experience for people that happen to be managers or people leaders. As it relates to HR, I just want to share some examples. I don't even think this is all of them, but here's several examples for our users to just see of how Stanford is using ServiceNow to support HR processes. And I think a lot of these processes have a touch point in Workday. Some may not. But Peter, why don't you walk us through maybe one or two examples from the HR catalog here?
Sure. Yeah, as you mentioned, Natalie, there are some of these that are really in support of Workday, and other things that are separate and discrete entirely. We have things here with, say, an interesting example is our meal period waiver election form. This is a more recent project we did with our HR partners, where we needed to support our elections from our nursing union and their the nurses in our environment, where they could opt in and change elections within Workday and within our timekeeping system to comply with contract and legal needs within the organization. So trying to bring all those systems together, we could build one workflow in ServiceNow that would be able to gather the right data one time from the user, rather than having to say, okay, enter it in one system, we'll track it through, we'll do some things. Now we need to gather data in another system, but we could bring all of that together to make one seamless process for the staff to find and access, to make changes to how they handle meal waivers. Likewise here, as if there are questions about PTO, the inquiry that has connection to Workday, and the core data lives in Workday as to what my balance might be on my PTO. But if I have a question about that, about something that maybe was on my about how I want to utilize PTO or ATO, I can submit that request here as well and have that sent over to an HR service team member who can help me understand what my benefits or what my elections might be.
It's funny that you bring up the meal waiver, because I specifically remember managing that 100% manually as an HR person.
Yeah.
Working with the clinicians and yeah, I'd rather not remember that, but I'm glad that you're able to work that out in ServiceNow. That's great.
Sure. I guess one last thing I'd just say there, Natalie, is we also have multiple entities within Stanford Health Care.
Ah.
So we
Mhm.
also, one of the benefits that we've found with ServiceNow is we can tailor the services that we offer based on the affiliation of the employee who's accessing the portal. So
Absolutely.
depending on where you work within Stanford Healthcare, you may have access to different services.
And that's something I've heard, Chris, tell me if I'm wrong, but I have heard that feedback that when it comes to entity specific, role specific, location specific functionality and visibility, that's one area where ServiceNow tends to shine, and where, Workday might have a harder time accomplishing that level of personalization.
Yeah, I mean, I think ServiceNow, obviously, because it is a broader umbrella, I think allows for a little bit more of that granularity that you'd be looking for to do that.
That flexibility is certainly when we implement ServiceNow for our healthcare customers. That is one thing that they really appreciate, is the flexibility to personalize those workflows and experiences. So great mention, Peter.
Sure.
All right, let's move on. We'll spend a couple minutes here on finance.
Yep. So, here are some of our use cases within finance, and again, kind of our main landing page. But as we dive into a more specific use case here around cost centers, again, this is an example where the actual cost center configuration, definition, and functionality all lives within Workday. That's the system of record. But what happens when we need to make a change? Somebody comes in a new role, they get a new approval authority. How do we submit those requests so that finance can go in and update a cost center configuration to provide the right level of approval authority for that new manager or that new user? This form allows them to intake those requests, track the work, as well as you can see at the top of the form. We can embed instructions, we can embed links and information to knowledge or information that the submitter may need to reference when requesting a change to a cost center. So the one form allows us to do multiple things, bringing in policy, process related items, so that the user has one place where they can go do all of that work.
And if I'm not mistaken, many of your forms have conditional fields, right? So depending
Correct.
on what is selected in, say, type of request, the fields that pop up for that user are really only the ones that are relevant to that type of request. Is that right?
Correct. Yeah. So we build that as part of the design process of understanding, where are the decisions within that process? When do we need to potentially provide additional fields, a different, data collection based on the selections that the user is choosing, so that they can provide more information, or, rather than having to say, great, we've got ticket 1, 2, 3 for you. Now email back out, give us this other item. We can collect more of that up front based on what the workflow is that they're executing.
Awesome. I'll jump over to our last use case, and then
Sure.
we'll soon get to Q&A, because there's a lot of great questions coming in.
Yeah, and finally, continuing on that theme of, we have our Ask Supply Chain portal. So this is one of the newer portals that we've built out, and we actually leverage on the back end. We're leveraging ServiceNow's supplier lifecycle operations, and a lot of this we started with, with our materials management team. And some of the use cases that we had built as custom applications, and then migrated over into this full portal as we brought in Workday and did our development around Workday and with SLO. We really wanted to focus on how do we support vendors, and that was an area where, as we looked at ServiceNow and we looked at Workday, we realized, again, there was an advantage to using ServiceNow's vendor portal as the way that our supply chain team and our accounts payable and others within finance could interact with our vendors. Now, this is, again, something that is new. We're rolling it out. So it's not that every supplier that we work with is going through this portal today, but we're starting to use this and roll it out to our vendors, so that as we onboard the new vendor, users within Stanford can say, hey, I'd like to work with this new vendor. They can submit the information and we can trigger a request out to that vendor so that they can provide data to us and we can track and manage them. And then as they provide those services to us, they have a portal where they can come in and they can tell us, who are various points of contact that we should be working with within their organization. They can provide us materials that we may want update or new versions of. If they have a new tax form, a new certificate of insurance, they want to upload and provide that to us, they can do that through a portal. They can submit questions to our finance team about status and questions about various interactions they're having with Stanford Health Care.
What a great example. I mean, especially, you're branching outside of your immediate organization and providing that experience for vendor users, but also streamlining that for your internal supply chain teams as well. That's very impressive. Thank you for sharing, Peter, these wonderful use cases. I know we have a lot of questions coming in and some really great engagement. I quickly want to just give a few practical steps, pieces of advice. If you're listening and you're watching and you're seeing a lot of use cases that you relate to within your organization, number one, start talking to those business functions and documenting what use cases you are seeing. What are the department inboxes being used for? Right? What are the trends in terms of the phone calls that are being received? What are the spreadsheets out there that team members are using to manage their work? And to really begin documenting that and starting to see the bigger picture of where you may be able to build a very strong business case to move a lot of these workflows and user experiences into ServiceNow. And secondly, share the vision. Right? What you're seeing here today, I'm certainly feeling inspired. And Stanford's just been so kind. Peter and Ritesh have been so kind to share their journey with Optimum so that we can get the word out to all of you. But really sharing the vision, sharing this webinar once it's posted to our website and you're able to help educate others about the possibilities here and how it can impact them positively. And then finally, once you have implemented, hopefully you'll partner with Optimum to help you with this strategy and execution. But either way, come on Healthiest Tech, share your results, get out there into the healthcare community and talk about the benefits that you're seeing from this approach. I'm sure that you'll have a lot of great use cases to share with others as well. All right, Peter, do you want to add anything?
I was just going to say, Natalie, I mean, there's a huge amount of opportunity there. And again, there's probably more automation, more build than that you could do in the next many years. So I think some of it is finding a good starting point for your organization, what makes the most sense. Where are the biggest pain points that you want to bring visibility and automation to? Start with those and look to see where you can, build a foundation and continue to expand upon it.
That low-hanging fruit, right?
Absolutely.
All right. Well, that wraps the content portion of our session today. Peter and Chris, thank you so much. I'd love to open up to Q&A and Scott, maybe you can give us, and we have Ritesh here joining us. Thank you, Ritesh, for answering questions in the chat. But what other questions can we answer for our listeners here?
Yeah, Ritesh has definitely been active in the chat. Thank you, Ritesh. And I just dropped some contact information for Natalie, Chris, and Peter for you all to get, as well as a link to ServiceNow's Optimum ServiceNow offering in the chat there for you guys to explore that more. But there has been a lot of questions. One thing that came up, there was a question about, Sarah asked, are there any Employee Center or SharePoint integrations? And I think that kind of leads to a larger question: are there opportunities for further integrations with other systems, such as EHR or billing? I was just curious if you would care to comment on that.
Sure. Now that Ritesh is on the screen, I have to take a moment to acknowledge, not only has Ritesh been great here fielding questions today, but all of what we've been able to share today has really been enabled by Ritesh and his team. They're an incredible team. I'm very lucky to get to work with them. In terms of other integrations, Scott, yes, SharePoint, ServiceNow does have capabilities there to expand search, from your portal out to SharePoint portals. There are lots of other systems that we integrate with, from the technology standpoint. So there's a wide variety of business processes that you can bring together through ServiceNow. And, I think it's one of the real strengths of the platform is it can connect many different platforms. At least we've seen that. And Ritesh, I don't know if you have any other comments on that, given you've built a lot of that and explored it with the team.
No, again, I think thanks Peter for that, but as we started this conversation, right, it's not about replacing one system with other, right?
Mhm.
I think Bill McDermott says that in all the knowledge conferences, if you have made investment, we'll make you look good with that. So it's about what your landscape is and how exactly ServiceNow can really help improve your experience and bring the systems together. And SharePoint was a good example, but I also throw in a few examples where how we are managing a volunteer workforce right now. Now, some of those workflows cannot be handled in Workday, so we have another system which manages that. But we really want to elevate the experience for volunteer onboarding. So all the processes and functions are really happening through ServiceNow, where we still have a third-party system to manage the core volunteer records. Like if they need a badging request, they don't need to wait for it. Once they are inserted into the core system, all the workflows are automatically triggered through ServiceNow, and they get the badge on day one. Right? Those are just some examples. Like look at the system that you have invested in. Opportunities to get rid of them and bring things to ServiceNow is great. But if you cannot get rid of them, bring the experience and engagement layer to ServiceNow and make life more simple for the users.
Great example.
Yeah, that is great. I want to respect people's times, and we are just about at time. I want to thank everyone for joining us. Again, I dropped the information for the speakers in the chat. Please do reach out to them if you have more questions. Please do go to Optimum's page and go to Spotify and check out the past Healthiest Techs. Go to Optimum's website because we got another exciting one coming next month that we hope to see you at. But for today, we just want to thank Ritesh, Peter, Chris, Natalie. It's been awesome. And I know that the audience appreciates it as well. So thank you.
Thank you very much for having us. I really enjoyed the conversation.
Thanks, everybody.
Thanks, everyone, for joining.